Thank you, Madam President. I'm not going to get into a lot of the things that Senator Durbin got into about increasing the lifespan of Medicare or issues that revolve around folks who get charged more just because they're a woman. But I do want to approach this health care debate from a standpoint of how it's going to impact rural America, because it's going to impact rural America in a huge way. And before I start my prepared remarks, I just want to say something. For the last 6 years, I have listened to folks stand on this floor and talk about repealing health care, repealing health care, repealing health care. And now the folks on the other side of the aisle can do it if they want. But for the last 6 years, I have never seen a plan to replace the Affordable Health Care Act. And I still haven't seen a plan. And I'm going to tell you that if we repeal this bill without a plan to replace it, we've got big, big problems in this country. And if we repeal this bill without a plan that increases accessibility and affordability across this nation in urban and rural and frontier areas, we've got big, big problems. I've been visiting for the last, well, it's been over a year, but more specifically since the election, with folks across rural America on the impacts of repealing this health care bill. These are folks who work to feed our country, farmers and ranchers. These are folks who work with their hands to manufacture products that have that Made in the USA stamp on it. These are folks who teach our children, who help keep our families safe, who operate retail businesses on Main Street. These folks, in my opinion, are the backbone of this country. I'm proud to be a product of that rural America, hailing from a town, a population today is about 600 people. So I'm not here talking about what's going on in Chicago or LA or New York or any other big cities. I am going to talk to you about communities where you know your neighbor. Communities where you're driving down the street and you see that pickup and you know who's in that pickup. Folks who, when you go down to the local grocery store, you know their first name. These are towns where often the hospital is the largest employer, and it is the only source of health care, that foundation that keeps families healthy. I'm here to talk to you about how this Affordable Health Care Act has been so important to those families in rural areas and states like mine. By the way, all of Montana is rural. Today, more Montanans have health insurance than ever before. That's undeniable. Folks are no longer denied coverage by insurance companies because they have pre-existing conditions like diabetes, or that they're forced to pay higher premiums because they have common ailments like high blood pressure. Children are able to stay on their parents' insurance policy for a time until they finish their college career or launch the lives of their own. Folks who have life-threatening diseases like cancer can now finish the treatments without hitting an arbitrary cap and be kicked off their insurance plan. Now they're required to be able to stay on. And seniors can get out of the prescription drug donut hole faster, which was costing them millions of dollars each and every year. In fact, since the ACA was signed into law, Montana seniors alone have saved $56 million in prescription drug costs, and there's enough money in the bank, as I said in my opening, to keep Medicare above water through 2028. These reforms have made incredible impacts to people in the rural America, and just don't take my word for it. Listen to everyday Montanans. I've been traveling across that state, hearing their stories, hearing their struggles, hearing their successes. Just this weekend, a man stood up at a public forum I was hosting in Missoula and talked about how the ACA saved his life. He told me that he had a heart attack the previous week. He was home, started having some chest pains. He picked up the phone, called his doctor, a doctor that he had thanks to the insurance he received under the ACA. Luckily, he survived his heart attack, was able to get the treatment he needed, and able to come to my roundtable that I had in Missoula, and he told me, I know myself that if I did not have insurance and I could not afford to get it without the ACA, I would not have called the doctor and I would have died. As pointedly as that, he would have died. I've traveled around Montana. I found that this story is not unique. I can take you to a coffee shop in Havre, population 10,000, where seniors have told me that they no longer have to choose between prescription drugs and heating their home. I can take you to a grocery store in Great Falls where a man came up to me and said, I finally have peace of mind that I won't lose my home if I get sick. Or I can introduce you to my best friend growing up in Big Sandy, who now lives in Seattle, who no longer can be denied coverage due to the fact that he has diabetes, a pre-existing condition. These are real success stories and real life impacts across Montana and across this country. But rather than build on the successes of the ACA and fix the problems with the ACA, there are folks in this body who want a full-scale repeal, ignoring any of the progress that we've made. They want to go back to the old health care system. And here's what that would look like in Montana. 152,000 Montanans with pre-existing conditions will be at risk of losing their health care plans. 61,000 Montanans enrolled in Medicaid just in the last year, because that's when Medicaid expansion actually went into effect. 61,000 Montanans will lose their health care coverage. Montana seniors will lose help paying for their prescription drugs. Insurers will be allowed to subject every Montanan to lifetime and annual caps on their coverage. And a woman will lose important protections that prevent them from being charged more for coverage than men. And it just doesn't stop there, folks. Their plan to repeal health care coverage without presenting a replacement just doesn't impact families. It will wreak damage on our rural hospitals and clinics too. I will tell you that if we lose these hospitals and clinics, and we all know how rural America is drying up, it's another death nail in the coffin of rural America. Folks won't be able to live there if they're over the age of 50 because they will have no access to health care. The Affordable Health Care Act has provided rural hospitals and clinics a level of certainty that, quite frankly, they've never had before. Everyday folks in rural communities rely on their local hospitals and clinics for everything from basic checkups to emergency treatments, I know. And as folks age, they have the peace of mind to know that they can visit their hometown provider without being forced to travel long distances. But if folks in Congress want to take us back to the old care system, they put these local hospitals and clinics at extreme risks. Take Mineral County in Superior, Montana, in Mineral County. County is home to just over 4,000 people, not a lot by national standards, but a lot by Montana standards. Nurses, school teachers, construction workers, all folks who want reliable access to affordable care. According to the Mineral County Hospital CEO, a repeal of the ACA would mean a real loss to that community. The hospital would be probably shutting its doors. Without a hospital in that community, folks would be forced to travel over 100 miles, deliver their baby, or take expensive air ambulance rides, which is a whole other problem for emergencies that come down the pipe like a broken arm. And if I'm a new parent or senior, I'm not taking that risk. I'm going to be moving closer to a hospital, because there are a lot of folks who can't afford to leave their homes, in some cases homesteads, where their families have lived for generations, to move somewhere for medical care. I can tell you in my small community, there are a lot of folks when they hit age 65 that have to move to a bigger town to be able to have access to the kind of specialty care that they need. You can move that age down to age 50 if we lose these hospitals in these rural areas. They not only keep patients alive, these rural hospitals, they keep communities alive too. And a repeal of the ACA, I am told, by the hospitals, would kill those rural hospitals, which, as I said before, would be another nail in the coffin of rural America. Let's take, for example, though, the Billings Clinic, which is Montana's largest healthcare provider. They're responsible for innovating and providing critical resources to rural areas through things like telemedicine. But the Billings Clinic won't be able to make this large-scale impact anymore if their patients are no longer able to pay their medical bills, because they lose access to Medicaid or cost-free preventative care, or insurance from the marketplace. Repealing the ACA will restrict their ability to provide quality care and jeopardize their standing as a pillar in Montana. It's not just hospitals either. It's community health centers, serving over 100,000 Montanans every year, fully a tenth of our population. They're at risk of losing 70% of their federal funding. Let me repeat, if health care progress is repealed, the community health centers in Montana will be at risk of losing 70% of their federal funding. This would be devastating, not unique to Montana, but this is how it's going to play out across this country in rural areas with hospitals and clinics. More uncompensated care, more trips to the emergency room without insurance, more hospitals facing the grim reality of having to close their doors. Oftentimes I wonder if it really matters to Congress. It looks as if they intend to go through their plan, which will have devastating impacts on the patients. And by the way, it'll have devastating impacts on the taxpayers. Repealing this health care coverage without a replacement will add an additional $350 billion to the deficit and the debt over the next 10 years. And this budget resolution will saddle the next generation with an additional $9 trillion in debt over the next decade. You know, it is amazing. When I came to this body, there were folks talking about the debt all the time. In the last 2 years, I have heard little talk about the debt. And with the exception of Rand Paul, everybody that were supposedly deficit hawks voted to increase our deficit and debt by $9 trillion over the next decade. This would push our total national debt to nearly $30 trillion by year 2026. Mr. President, I stand with Rand Paul on this one. Hamstringing the next generation with additional debt is unacceptable, especially when you're taking away their health coverage to boot. As folks try to jam this bill through Congress, I have barely heard a peep about this increase to the deficit. Oh my, how times have changed. The folks who are normally card-carrying members of the fiscal restraint are now swiping the credit card of the next generation. I dare those members to go back home and tell your neighbors you're going to take away their health coverage. And oh, by the way, we're going to add about $9 trillion to your debt, too. Try to do that with a straight face. Now, I will be the first to tell you that the ACA isn't perfect. I've heard that also in my travels across Montana. Costs have gone up, premiums are rising, many hardworking middle-class families cannot afford health care. That is unacceptable. So we ought to do something about that. Let's tackle rising premium. Let's hold health insurance and drug companies accountable. Let's put patients before profits. But I'm telling you, repealing all the progress we've made won't do that. We need to build on the successes we've had the last few years, not tear them down. Members of this body, quite frankly, this is not just a debate about health care. It's a debate about our economy, our growing deficit, the foundation of our rural communities. The folks in this Congress who are pushing to repeal without a replacement will kick families off their health insurance, close down rural hospitals and clinics, add $9 trillion to the debt if they succeed. Rather than go down this dangerous path, I have a suggestion. Let's roll up our sleeves and work in a bipartisan manner to increase access and affordability, to lower the cost of care, to bring down prescription drug prices. Tell you, I'm willing to work with anyone, Republican, Democrat, Independent, Libertarian, whoever wants to have a serious conversation about improving our nation's health care system. But I'm not going to allow folks in this body to take us back to the old days, the days where our friends and our family couldn't afford to get sick. Members of the Senate, it really is time to listen to what's going on the ground. And we have an opportunity to build on the progress we've made and work towards a bipartisan solution that will work for the backbone of this country, the folks in rural America.